Welcome back, America. One of the great things we have is a partnership with the Wellness Company. We get so many benefits, including you getting great discounts on the many great products and the great telehealth medicine advances that the Wellness Company is doing. But another great benefit is we get to talk to one of the greatest medical experts I know, Dr. Peter McCullough. He's joining us right now. He's the author of a new book, Vaccines, Mythology, Ideology, and Reality. Everybody's talking about it. Dr. McCullough, good to have you back on.
Thank you.
All right. I would say you are one of the instigators of what I think is a health freedom movement. And today, a couple of doctors filed a lawsuit to advance the cause of freedom in medicine. Tell us a little bit about it.
Pediatricians Dr. Paul Thomas and KP Stoller have filed a lawsuit against Suzanne Monarez and the CDC. Monarez is now the director. And the lawsuit is essentially attacking what the CDC lays out as its recommendations for the criteria of vaccine exemption. Remember, being exempt from childhood vaccines is a contentious issue from state to state. And unfortunately, the states take the CDC guidance and they make it into state law. They make it into in some states, very severe, rigid recommendations and requirements for kids to go to school. Well, these two doctors are trying to break all of that up. No vaccine is without risks, and the CDC's guidance doesn't take into consideration, more subtle degrees of immunodeficiency, autoimmunity, previous intolerance to vaccines, short of anaphylactic reactions, sibling reactions, and of course now parents' concern regarding chronic allergic diseases and neuropsychiatric diseases that may arise from combination vaccination.
One of the most amazing trend lines is you're seeing more and more parents filing exemptions, right? The CDC, I think, just had a report showing that more and more parents are exercising their right to protect their children. Talk a little bit about that trend and what might be behind it.
Well, it's been known now for years that healthy children today who skip all the vaccines, they actually have better health metrics than their fully vaccinated counterparts. Remember, we're giving vaccines for legacy diseases like diphtheria and pertussis, polio. These illnesses honestly have not been widely prevalent in childhood populations for a long time. And we're vaccinating for diseases that are readily treatable with antibiotics. And so what's been learned is that parents have caught on to this. And for a healthy child born today, many are choosing to go completely unvaccinated, keep the child healthy. Conversely, a child born with cystic fibrosis or congenital lung disease, children born without a spleen or have had the spleen removed due to trauma or for surgery for, let's say, a Hodgkin's lymphoma, different story. I think children, have a strong indication for the routine vaccines when they have these background conditions. So I think where we're moving to is instead of a one-size-fits-all vaccination for every child the same way, I think we're moving towards risk stratification, much more parental choice in what's going on. And honestly, I think it's going to be better for everybody.
Yeah, and those two doctors moving that ball forward today with their extraordinary lawsuit. You have made it possible for all of us to stock up and have emergency medication on hand with those great emergency kits. President Trump realizes there's a good reason for that, which is we don't have a lot of the supplies in America to make some of these basic drugs. He signed an executive order last week. How big a deal is it?
I think it's a big deal. I'd like to see it go forward and having some public-private partnerships where we have manufacturing in the United States like we used to for critical drugs for high blood pressure, diabetes, dyslipidemia, critical antibiotics. I think they should all be made. 95% of the drugs I prescribe are generic drugs anyway. If they were made in the United States, we wouldn't have to worry about tariffs, and we certainly wouldn't have to worry about drug shortages. Right now, everything's originating in China. What we've done at the Wellness Company is we have two pharmacies. We have ample supply for the critical antibiotics, antivirals. They're readily available in our emergency kits with replenishment programs. And then for chronic diseases and chronic problems where you're on a daily medicine, that applies to me. Then we can look at the memberships. Both the Premier and the Elite memberships have free prescription drugs, John. So I get my drugs free. That means no shipping, no copays.
Wow.
Just being a wellness company member, I get blood pressure, cholesterol, and other medications for free.
That is definitely worth checking out for anyone who has to pay a prescription bill every month. We know what a big savings that could be. We got about a minute left. I always get a big reaction when you come on the show, but last week when we talked about parasitic infections and some of the side effects, I got a delusion. In fact, I had to put a couple tweets out to help people find some of the stuff and get them appointed. Tell us a little bit why parasitic infections are becoming a bigger concern, why people are paying more attention to them.
Well, because people are eating more sushi, more raw uncooked food, more pets, and the ability to actually pick up spores and get difficult to diagnose parasitic infections readily treated with the wellness company combination ivermectin mebendazole parasite cleanse product. But it's also used off-label now as an anti-cancer agent on top of everything else people do.
Wow.
Now a recent release from UCLA Cedars-Sinai indicates ivermectin is moving into cancer trials at major university medical center.
And a few years ago, they wouldn't even let us take it during COVID, even though there were good signs that it was effective. It's amazing how far we've come. Mostly, a great credit to you, sir, for all the great work you've done. Dr. Peter McCullough, love to have you on. Thanks for joining us today. All right, folks, if you want to take advantage of all of the great telemedicine that Dr. McCullough has, just go to twc.health/justnews, twc.health/justnews. Use the promo code JustNews. You'll get incredible savings, including $60 off on that parasitic cleanse and free shipping. A great offer. Go check it out. All right, we're going to take one final break. When we come back, we're going to talk a little politics. Yep, there's some of that going on in Washington. But first, a quick message from our great sponsors.